ahead and get started here. What we have before us today, committee, is to work House Bill 2463, which is the CanCare extension. And we had talked about an amendment the other day when we heard it. You'll see it all in one amendment today because we've got 3 amendments to adopt. So want to hear what the committee has to say. Comments, discussion, questions? Nobody? Representative Arnberger.
Thank you, Madam Chair. Just want to also state again, this is not my bill.
Well, we're going to partially fix that, but just partially. Okay, so Scott, if you'll hand out the amendment we had drafted. We went through there, and I want the folks out here in the audience, especially Sarah, because I think Sarah had pretty much the same list of concerns that other people also had, but we tried to take all of those into consideration. So I'll make sure everyone out there can get a copy as well. Okay, committee, so what you have here before you is, if you remember, our Medicaid director, Sarah Fertig, had talked about CMS not wanting to and probably would not approve a 2-year extension. So the first balloon you see impacts on, there's only one page to the bill, so you won't hear me talk about a page, is Section 1, Line 6. We take out 2026 and make it 2025. That then impacts, and you'll see a second balloon, excuse me, line 13, sections, or no, line 12, where it's 2025, now becomes 2024. That was in section B. Line 17 in section C, remove 2025, replace with 2024. Then you will see the large balloon that we have, that will be E. Nothing in this section shall be construed to prevent any state agency from taking any action that is required by an act or appropriation act of the legislature, federal law, or the United States Centers for Medicare and Medicaid Services. F, prior to January 1, 2025, when the legislature is in session, a state agency may submit to the legislative coordinating, or not in session, excuse me. Let me back up. Prior to January 1, 2025, and when the legislature is not in session, a state agency may submit to the Legislative Coordinating Council a request to make a substantive or material change to the medical assistance program. The Legislative Coordinating Council may approve such a change to the medical assistance program that is not otherwise prohibited by law. So those are we can call it, that's the 3 balloons that we have on here. Questions, comments? Representative Barker.
Thank you, Madam Chair. I think it covers it now. There was some concerns with the contractors for bad actors that, by my understanding of this reading, and I'm just reading it for the first time, does that now give the state agency to take some action in case you do get one of the 3 agencies or the contractors that are bad actors? And if you recall, we had that a few years ago with Aetna.
Well, I think it was before Aetna, but Aetna had hiccups, yes.
Okay, they had problems too.
Yes, you're fine.
But I guess my question is, that fixes that, correct?
It does, and some of the other things that the Medicaid director had actually listed, which was the ability to, let me get on the right page here. Yeah. The ability, adding new drugs, treatments, services to Medicaid coverage, they'd be able to do that. Increasing provider reimbursement rates for certain services, because we do have some that I believe that Representative Carpenter is looking at. Completing projects in progress, such as phasing in the certified community behavioral health clinics and implementing electronic visit verification for home health services. Implementing recent recommendations from legislative committees, including the Robert G. Bethel Committee on Home and Community-Based Services and Care Oversight, the 2021 Special Committee on Mental Health Modernization and Reform, the 2021 Special Committee on Home and Community-Based Services, Intellectual Developmental Disability Waiver. That's why IDD is a lot easier. If CMS approval is received, finally implementing 2020 House Bills 2168 and 2246, which would draw more federal dollars into the state to support hospitals and allow the state to make changes needed to ensure the Healthcare Access Improvement Program, which is, we call it HCAP, is solvent. And then the list kind of goes on. So that's just reading from Sarah's testimony that you should all have in your packets.
All right, well, thank you for that clarification.
Yeah. Further questions? Representative Wolfmore? Did someone over here have a question or a comment?
I'm still thinking of it.
Okay, that's fine.
Jim.
Okay. Sarah, do you have comments?
I do actually, Madam Chair. Turn this on, thank you. I do actually, Madam Chair. Afternoon Committee, Sarah Ferdig, State Medicaid Director, KDHE. So this would shave down 1 year from the time period when we would be blocked from making changes without approval from the legislature. However, I would point out that it still would not address some of the more urgent needs that pop up with Medicaid from time to time. When we had a hearing on this bill, I gave the example of when there was an RSV outbreak on the eastern border of the state with Missouri, and we received urgent messages from primary care providers asking us to open up a particular drug for distribution to Medicaid beneficiaries, because the Medicaid policy says you can only have this drug between October and March during cold and flu and RSV season. This was happening in August. So within a matter of, I don't know, maybe 24 to 48 hours, we had to act quickly, change our systems, have the MCOs change their systems, changing the policy of when we could issue that drug to Medicaid beneficiaries so that kiddos who are at risk for serious complications with RSV could get that drug in August when they needed it. My concern, Madam Chair, is that if when the legislature was in session, if we had to wait for the legislature to act to tell us we could make that change, that could be between January and sine die. It could take 4 months for that change to take effect. And even when the legislature is not in session, the LCC is authorized to meet 1 day a month. So they have one meeting a month. So what if we get that request and the next LCC meeting is not until 3 or 4 weeks later? What that means is that we were delayed in responding to the requests that we're getting from providers and from beneficiaries. So that's my concern. This would still block us from making swift, needed changes to the program in a timely fashion.
And we took a lot of those into under consideration, and we feel that if such a thing arised, that, and Scott's looking this up right now, but I believe that the LCC can be called at the announcement by the chair of the LCC, so that would not be an issue. They do have the ability to cast their votes via WebEx. So again, it wouldn't be a matter of getting people to travel. This is not the first time that the state of Kansas has done this on their Care, extending it out a year. And we all survived during that one there, but we did take those things under consideration, so I appreciate that.
Well, respectfully, Madam Chair, I have no guarantee that the LCC would convene if I asked them to convene to vote on something, and we also would have no guarantee that they would approve the change, even when it's being requested by our providers. So I would, respectfully push back on that a little bit, that this could still mean that our hands are tied and we're not able to take action. And this would be for a 3-year period. And I would also add that this would take effect upon publication in the Kansas Register. So we would have maybe a week and a half to quickly withdraw state plan amendments that are currently pending at CMS. And, we would have a week and a half maybe, or 2 weeks, to very quickly halt everything that's currently in process with Medicaid. So we wouldn't have a lot of lead time before everything had to grind to a halt.
Well, and I probably would put a lot more weight on that, Sarah, if we had not done this before and, everything went through the process and we went through it very smooth. I think there's a lot of concern that hopefully we are at the tail end of the worst of our pandemic. COVID's never going to go away, I think. So it's not like it's erasing and disappearing. And we've gotten the CanCare program, running very smoothly right now. We also don't want to have to go into the possibility of, with a new administration, bringing on a brand new, maybe it's all 3 brand new MCOs, and then having a bunch of hiccups occurring, et cetera. So I think this gives it a much smoother ship to sail forward. Representative Wolfmore.
Thank you, Madam Chair. So and you might want to speak to this too, but we say we've done this before, and that was my initial concern about this, so I checked on that, and before it was agency driven because they weren't actually ready to execute. This is the first time that it's been a legislative driven, so we're actually passing a law that would give a no bid contract to the MCOs, even if it's just for 1 year. So this is very different than what we did in 2017. And I have to wonder what procurement rules were violating. I mean, I don't even know if this is legal. I'm certainly not going to sign my name to a 1-year extension no bid contract. That causes me great concern. So it's very different than what we did, I think it was 2017, because the agency wasn't ready.
Other comments, questions? Representative Kelly?
Thank you, Madam Chair. Is it okay to ask Sarah a question?
Yeah.
Sarah, as far as some of the things we had discussed that were in your testimony, like the new reimbursements for hospitals and some of those, does this solve it or it doesn't solve it? I mean, are complicated?
Madam Chair, so it's some of the confusion that existed with the prior version of the bill prior to this amendment are still there. It's still not clear to us what's considered a substantive or material change, but we make something that I would consider a substantive or material change almost every day in the program. So our concern is that it would delay or possibly even block some of those very routine changes that we make all the time, because we're essentially operating an insurance company and we have to make shifts all the time. There might be new codes coming in. We might have new groupers coming in from, the federal government. There might all sorts of things that we have to do on a daily basis. And our concern is that if we're not able to do those without getting express legislative permission, which during the session can take 4 months to get that permission, or in the off season if we have to wait a month for the next LCC meeting, or hope that they're willing to meet on one of their budgeted days in between regular meetings, that the short answer to your question is no, it doesn't solve all of those concerns, because like I said, we make pivots all the time, and if we need to make a change from something that was previously approved by the legislature or previously approved from the LCC, we would have to go back to them and, get approval again. In essence, it would delay a system that currently works very smoothly. As the chair says, CanCare is operating very smoothly now. Our concern is that this would break what is not broken and cause delays, unnecessary delays.
And I believe, Sarah, that we are dealing with the issue that, perhaps the RFP should have been out sooner instead of waiting around October or November, especially in an election year. That doesn't make a whole lot of sense. The MCO's contracts expire December of '23, I believe.
That's correct,
So
yes.
there would be less than a year to go through the whole RFP process and then negotiations, et cetera. Then we're going to try to hit the ground running with possibly 1, 2, or 3, 4, who knows, brand-new MCOs, and only have a month and deal with a brand-new administration. So those are, it's kind of a balance. I mean, we can have, things that occur on the other side. I think what this here does by, I have a lot of faith in our LCC, and it is legislators that are on there, that they see a need, they're going to take and address it. So, but I appreciate your concerns. Representative Barker, and then Representative Reese.
Yeah. My only comment, I wanted to get back with
Yeah.
the revisor about the LCC can, on an emergency basis, call themselves. Is that correct, Scott?
Scott.
Thank you, Madam Chair and Representative. The statute directs the LCC to meet at least once
Once a
every
month.
month in the interim, and also provides that the LCC can meet on the call of the chairperson or any 3 members of the LCC.
And I think that eliminates that problem. The other one, they mentioned that when the legislature, it could be months. I've been in the legislature a few years, and I've seen emergencies come up, and we actually get a bill through the House, through the Senate, to the governor within 2 days. So when there is an emergency, we act, and we act swiftly. So because most bills during a legislative session are slow, but when we have an emergency, I'm always amazed how fast we can actually come together and work. So I'm very comfortable with the legislature doing that, and I'm comfortable with the LCC because on the call of the chair, he can have a WebEx call and get something done in 1 day. So just want to let you know that I'm very comfortable with that part of it. Thank you, Sarah.
Representative Reese.
I have a couple of questions of the director. What happens if this bill passes and CMS denies the extension through 2024?
That's a good question, and Madam Chair, it is true that all of our contract amendments have to be approved by CMS. We have never sent one to them that was ordered by the legislature in lieu of a competitive procurement, so there is a chance that they might decline to approve it, and that's, if that's the case, we wouldn't be able to extend the contract as directed by statute.
Another question is, I have been hearing some concerns that a nonprofit might be given a contract. I'm curious, does the KDHE have the authority to automatically award a nonprofit MCO contract?
No, Madam Chair, we do not. We do not. There's, we follow the state procurement laws. The last time the CanCare RFP went out for bid, you may recall there was a bid protest. It took months to resolve, and I think some of the lessons learned there is we stick to our state procurement laws very, very closely. And so there would not be any attempt to steer any contract award to anyone but the top 3 most qualified MCOs, period, regardless of profit or nonprofit status.
Representative Clifford.
Thank you, Madam Chair. Representative Ruiz asked really most of the question I had, but knowing that you are a proactive official, what do you have a sense of where CMS would be on this? Have you reached out already?
Madam Chair, respectfully, no, we have not on that particular issue on the contract extension. We have in regards to the 1115 waiver extension, which was initially contemplated, because our understanding is that was a hard no by CMS. We did confirm that. With contract amendments, typically though, CMS, they prefer to wait until they actually see it before they will tell us if they're going to approve it. They hedge their bets a little bit on that.
Follow up, thank you, Madam Chair. So where are you on the process? You had described a process of 15 to 20 months before. Are stakeholders making inputs now, or where are we at now?
Madam Chair, so we have our regular monthly stakeholder meetings next Tuesday, I think. We meet with dozens of groups on a monthly basis, and this is one of the agenda topics. We're going to start talking about brainstorming and getting them prepared for the formal stakeholder engagement sessions that are currently scheduled to begin later this month and early in March. And the timeframe we have is the same as the last two CanCare procurements. The only difference is that we're hoping to get the RFP out a little bit earlier, like a month earlier than it happened in the last two procurements, for the reasons that the chair described, that you need to have ample time to make sure that a new MCO can stand up and to make sure that any returning MCOs are able to meet new contractual requirements.
Thank you. Thank you, Madam Chair.
Representative Haswood.
Thank you, Madam Chair. I think it's really concerning that we're asking our top healthcare professionals to go through this process, especially during a health emergency that we can't foresee in the future. But can you kind of tell maybe just the regular people that everyone on CanCare, you know, what are we voting on today and how is it putting healthcare at risk for them? Can you kind of really explain that?
So, Madam Chair, I will try. So we currently have over 500,000 Kansans on CanCare, the most we ever have because of the pandemic. So we're covering about a sixth of Kansans, and these are kids, these are elderly, these are disabled. Really, our concern with this bill is that it will stop us from moving swiftly when we need to make sure that they have the access to care that they need, to make sure that, you know, when new therapies come online, that we have the ability to open that up for the Medicaid population swiftly, and so that we can solve problems when we become aware of them. If we have to wait to get the okay from the legislature or the LCC every time, what that's going to do is delay fixes that we would like to have. One thing that we're concerned about related to the pandemic is that eventually it's going to end, and then we're going to have to unwind from the pandemic. So that means we're going to have to start initiating renewals for CanCare members that we've been carrying on so far. It's unclear if we would have to run all that by the LCC before we could actually engage in that process, because while the unwinding process is required by the feds, the specific means by which we do it is not. The states do have some ability to control how they manage that process, so that certainly would be substantive and material. But then there's also some allowances that we made during the pandemic for disabled individuals that our sister agency, ks is going to have to figure out if they're going to unwind it and how. So this would kind of delay all of that, because we would have to wait until the LCC is meeting, coach them through all of it. And I would add, no one on the LCC is currently on the CanCare Oversight Committee. So we would have to bring them up to speed on these issues, coach them through it, and then hope that they would vote to let us do what we need to do to manage the program.
Thank you. Thank you, Madam Chair.
Representative Wolfmore.
Madam Chair, another question. So this bill was a bill with no proponents, has been mentioned several times. We've had lots of concerns from agencies and from stakeholders. The group we haven't heard from, though, are the MCOs. How do they feel about this? What's their thoughts on this bill? I've not heard from any of them.
In my conversations with them, they don't feel it's appropriate for them to weigh in on this issue because it's their contracts.
$8 billion worth of money. And then my next question is, I don't see in this, maybe Sarah can answer this, I don't see anywhere in this that allows us to police bad actors. I don't see in this amendment that gives you any ability to take care of any bad actors like we've had in the past. What are your thoughts?
Well, Madam Chair, it would mandate that the contracts be extended through the end of 2024, which kind of forecloses the nuclear option. If we truly had a bad actor and we needed to threaten termination, that would be a meaningless threat, really, because by law, we would have to continue the contracts through 2024.
I'm still struggling. Thank you very much. I'm still struggling with the real reason for this bill. I mean, it just, no one seems to be for it. And so I am just struggling with that.
Well, it's what I explained earlier is you have the issue. We know the struggles that we had getting canned care up and running in the first place. Then we had the struggles with AmeriGroup. Then Aetna come in, and for whatever reasons, the wrong people were in the wrong place instead of in the right place. We had hiccup after hiccup after hiccup, and that took us almost a year to finally get that smoothed out where it belonged. And the RFP probably should have already been released. It hasn't. It won't till maybe October or November, right in election time. And these contracts are up December 31st of 2023. So it's going to be difficult just getting through the procurement process of the bidding and then working out what those contracts are going to look like. So we're going to probably run up into December. January 1 or January, we will have a new administration, maybe not. They should have time to be able to, rather than having to jump in and negotiate on something that they did put out in the first place. It just doesn't make a whole lot of sense.
And I get that.
And that's how we could upset this apple cart on the canned care.
I get that, but the agency isn't raising the alarm that we need to do something. It's the legislature. And once again, this is an $8 billion contract. It will be a no-bid contract that the legislature is engaging in. And if that's legal, I'd be surprised, but at the very least, it looks and it smells bad that we are doing that. $8 billion. So I have serious reservations. Thank you, Madam Chair.
Representative Clifford.
Thank you, Madam Chair. As an ophthalmologist, I'm currently experiencing delayed care for my patients with the insurance company Aetna. They've decided that they have a right to delay cataract surgeries in their process of prior authorization. And despite efforts of Senator Marshall and folks actually on the other side of the aisle, the CMS has not forced Aetna to move on this, and it's egregious for our patients. I could see that this bill would enable that of our MCOs, but I will say, despite my reservations about this, I might vote in support of this only because I think all we're doing is asking our Medicaid director to ask CMS for permission to do this. And I suspect they will say no. I don't know that, but at its base, that's what I think we're voting on here today. Thank you.
Well, this goes beyond actually the Medicaid director just asking for an extension from CMS. This actually puts it on hold, Representative. And if you're having an issue with Aetna on something, then you need to bring that to the Can Care Oversight Committee, because that's what the Can Care Oversight Committee addresses.
Yeah, but, Madam Chair, sorry, and that's regarding Medicare, not Medicaid.
Okay, well, there's a big difference between Medicare Aetna and Medicaid Aetna.
I understand.
Same.
Same CMS, and we physicians deal with CMS as an organization, and there's great intransigence, and I suspect that this is all going to be CMS's decision.
Further comments or questions, Representative Kelly?
I just wanted to make sure if I heard this right, and I was like to ask Sarah on it. You talked about some of the groups that during the pandemic had been at it, were able to be at it, and then you'll have to come back. Was there also children that were at it that you would have to now come back and deal with signing? You might have mentioned that, but does that create an issue?
Madam Chair, so yes, during the pandemic, there were special rules in place under federal law. And basically, we weren't allowed to terminate anybody from Medicaid coverage unless they moved away from the state, unless they passed away, or if they called us and said, can you please terminate my Medicaid coverage? So the folks who are mostly impacted by that are the folks whose eligibility for Medicaid is income-based. so they have to be low income. And so kids would largely fall into that category. It impacts less the folks whose eligibility for Medicaid is based on the fact that they're disabled or elderly or pregnant, things like that. So, because income can fluctuate more. But yes, most of our kiddos are eligible by virtue of their parents being low income.
So you would have to go back and then qualify them, okay?
Yes, Madam Chair, we would. And we have, after the federal public health emergency after it expires, it's currently set to expire in the middle of April. It might get renewed for another 90-day period, but after it expires, we have to start doing those renewals and redeterminations to make sure that everybody is still eligible for Medicaid. And that's going to take, CMS currently is giving us 12 months to get through that backlog. We'd like to get through it a little bit sooner, but as part of that process, we might have to shift gears and do things a little bit differently, and that's when we would have to come and request permission to do that, to manage the program under this bill with the amendment.
So if that's 12 months, you can't even get it done this year.
Representative, Madam Chair, probably not. Well, because right now the public health emergency is set to expire April 16th. We kind of suspect they're going to renew it until July, and as long as it's going on, we have to keep these folks on the Medicaid rolls. It's not until that expires that we can start cycling folks off the rolls. But if it does expire in April, that gives us, 7.5 months to go through all of that backlog, and we probably wouldn't quite be able to get there by the end of the year, so yes.
So it'd cross over into the next administration.
In all likelihood, yes, Madam Chair.
Representative Reese.
There's been several things that have been very concerning to me, and I've been open about that. But one of the things that I'm really concerned about is the legality behind all this with the procurement process. So, I want to echo Representative Wolfmore, who says that we are going to give $8 billion to 3 insurance companies over the course of several years now. It's 2, I don't know if it's 3 now. There's no competition, there are no questions, no accountability. At least it seems now that maybe the LCC would be a part of it. I'm not certain that the LCC could really, be able to turn on the dime. I've sent a letter to the Attorney General's office so that we can provide us with legal opinion on this matter, because I'm incredibly worried that we're opening up ourselves for potential litigation. With that, I have a motion that we that we table this final vote until we have an opinion from the Attorney General regarding this bill.
You have a motion before you. Is there a second? Second by Representative Wolfmore. Questions, comments, discussion on the motion? Well, we don't even have the bill in play yet, do we, Scott?
We don't.
So the motion's not in order at this time.
Let me put the bill in place
Would that-
and then we'll. Let me do that.
Well, let's see what Scott tells us to do.
Okay.
I just want to make sure we're,
Yeah. Right, no, I know.
both of us.
Madam Chair. If it's a motion to table, it's a non-debatable motion.
Oh, it is a non-debatable motion, correct?
Thank you.
But Madam Chair,
Representative Berquist.
Yes.
Representative Poskin mentioned whether there was an open amendment or not. Is there an open amendment at this point? And does that make any difference? It can still be tabled?
No, we didn't make a motion on amendment, I don't believe.
Okay. Thank you. All right. Thank you, ma'am.
Been a lot of years since I had a table, so I want to make sure we do it right.
House Rules 1306, does that sound right?
I think you're right.
I don't think the House rules speak specifically
Tabling.
to if the bill must be in play first.
Okay. So we'll just take it that it's not debatable,
I think it is a non-debatable motion.
but it's a legal motion. Okay. All right. The motion before you, which is non-debatable by Representative Reese, is to table this at this time till Najee's opinion is received. All those in favor signify by raising your right hand. Nine? You got 11?
I can't. Is your hand up?
Yeah. What you got, Scott?
3,
Keep it up.
5, 6, 7, 8, 9, 10.
I thought I counted right.
Yeah, you did.
All those opposed, same sign. Five, motion passes. Bill is tabled. We are adjourned.